So now we're going to begin a 5-part series on psychological disorders and diagnosis. This is one of my areas of specialty because I'm a clinical psychologist. So we focus on identifying, assessing, and treating psychological disorders. And when many of you think about psychology, it's likely that you're thinking about what we call abnormal psychology or psychopathology. So why should you guys learn about psychological disorders? Well, there might be personal familiarity with psychological symptoms as we talk about, symptoms of depression and anxiety. We all have some of those symptoms, or you may have family members who actually have a diagnosis of a disorder like schizophrenia or a substance abuse disorder. So it's important that we understand these disorders a little bit better. You might want to hear about how to prevent some mental health issues because a lot of these issues can be preventable. And we also have to understand how socially devastating these disorders can become in our society. For example, depression is one of the biggest gluts on our economy because when people become depressed, they go on disability, they're no longer capable of working, etc. And so by treating people with depression, we can kind of eliminate some of these problems both for themselves and for society. And we just want to learn more about mental health and human nature. So there are different perspectives on psychological disorders. So we want to define them, understand them, classify them. There's a labeling. We can talk about insanity. So when we think about psychological disorders, here are some questions to keep in mind. So how do we decide when a set of symptoms is severe enough to be called a disorder that needs treatment? And I think this is a very good question, and I think it's still a question that we haven't really answered very well. Can we define specific disorders clearly enough so we know that we're all referring to the same behavior or mental state? So if I say depression, will we all be thinking about the same construct? And can we use our diagnostic labels to guide treatment rather than to stigmatize people? And so, for many times, a lot of people are scared to go to psychotherapy because they feel like it's kind of stigmatizing, and there's still a lot of stigma associated with mental health diagnoses because it seems like the people are kind of not strong enough to handle it on themselves. And so we have to think about, why this is the case and why this is stigmatizing when it really shouldn't be. So psychological disorders are patterns of thoughts, feelings, or actions that are deviant, distressful, or dysfunctional. So the 3 Ds, and we'll talk about this more when you take 242 Abnormal Psychology, which I also teach if any of you are interested in taking that with me. So from this definition, we hear the word disorder, and that refers to a state of mental or behavioral ill health. It's kind of like a disease, I guess, for lack of a better word. Patterns refer to a collection of symptoms that tend to go together. So it's not just one symptom that you have that says that you're depressed. For example, we know that one of the symptoms of depression is suicide, but not everybody who is suicidal is depressed, although the majority of people are. But in order to have a diagnosis of depression, you have to have an additional 4 symptoms in addition to suicide or another combination of symptoms. There also needs to be some distress and dysfunction. So one of the key things that we identify when making a diagnosis is that the symptoms must be sufficiently severe to interfere with one's daily life and well-being. So they have to interfere with your ability to do your work, to function at home, and function in society. And at that point, that's when it becomes a disorder. And then deviant means differing from the norm. And this is obviously sometimes controversial because we have subcultures which sometimes are considered deviant, but it's normal within that subculture. For example, people dyeing their hair green. I mean, granted, most people are not dyeing their hair green, but within, being a young person, that's acceptable behavior. So what is deviant? So deviant in general means to vary from what would typically happen. But we have to consider deviance within a culture. So we have to see what's different from what would be expected in that culture or within that subculture. For example, you've probably seen in the South, oftentimes in some of the religions, people get possessed by spirits or demons. And so, in other areas, this might be considered to be kind of psychosis or some sort of schizophrenia, but part of that subculture or that religion, that's very acceptable to get possessed by demons, and that's acceptable behavior, so it's not considered deviant within that subculture. A disorder may also be a deviation from a typical developmental pathway. So defining deviance, the role of culture and context. So you have to look at the situation. For example, if a kid is yelling for hours at home, that's deviant behavior. But if you're yelling for hours at a football game, that's socially sanctioned, so it's not. And so look at these guys down here. Their painted faces might be considered deviant if they were going to school looking like that on a normal day. But for a football game, that's completely acceptable. So we've probably all heard of attention deficit hyperactivity disorder, or ADHD. Is it really a disorder? Is it deviant? Do some people have a level of inattentiveness, impulsiveness, or restlessness that goes beyond laziness or immaturity? Is it distressful? Is the person enjoying being energetic, or are they frustrated so they can't sustain focus? And is there a dysfunction? Are these symptoms harmless fun, or do they negatively impact work and relationships? So you can see that there's a spectrum. For example, we all have some criteria of ADHD. We all have inattentiveness, impulsiveness, and restlessness sometimes. But when it gets to the point where it's causing us distress, or those around us distress, and it's impairing our ability to do our work or to function at school, etc., at that point, that's when we're going to consider it a disorder. So looking at this from a little bit of a historical perspective, one of the reasons we diagnose mental disorders is so that we have a course of treatment. And so we kind of have to have a common language in order to develop a treatment. So we want to understand the nature and cause of psychological symptoms. In the old days, we used to think that psychological problems were caused by being possessed by spirits. So they actually used to literally make holes in people's skulls to release these spirits. Clearly we know that doesn't work anymore, and by drilling a hole in somebody's head, we're likely to kill them. So Pinel in the 1700s, early 1800s, was the first to kind of talk about mental illness, and we had obviously treated people with mental illness brutally. We kind of thought they were possessed by evil spirits, or they were witches or something like that. But he kind of helped move this into a new understanding, and that these individuals were actually mentally ill. And so he proposed that mental disorders were not caused by demonic possession, but by environmental factors such as stress and inhumane conditions. And so he proposed that we treat these individuals morally by improving their environment, not locking them away, and replacing the asylum beatings with patient dances. Well, we know that that's not necessarily a cure. It's obviously more humane than drilling holes in their head. And so Pinel's humane environmental interventions improved lives, but often didn't effectively treat mental illness, because we know that dancing, as fun as it can be, doesn't necessarily cure mental illness. But then the discovery that syphilis, which is a virus, I believe, can cause mental symptoms by infecting the brain, suggests that there's a medical reason for mental illness. And so they saw people who had syphilis, and then they started exhibiting a lot of these symptoms of mental illness that people were seeing. So now they started to speculate that there's a medical reason for these disorders. So we started to view psychological disorders as psychopathology, or an illness of the mind. And therefore we could diagnose them and label a set of symptoms that go together. And based on this, we could then provide treatment and restore people to good mental health. One of the things that you're going to hear a lot about if you continue in psychology is the biopsychosocial approach. So this is what we use to describe what causes mental illness. So there's not really one direct pathway. There are biological influences, and some disorders like schizophrenia and bipolar disorder have more of a biological influence than others. There are psychological influences like stress, trauma, mood-related perceptions and memories, learned helplessness. So these are things like being in a war zone, being raped, things like that can cause people to experience psychological problems. There are also sociocultural influences like role expectations and the definition of normality and disorder. And all those go in together to make up psychological disorders. And so there's a biological component, a psychological component, and a cultural or environmental component. And we basically see that there's an interaction between nature and nurture. People are genetically predisposed oftentimes to be susceptible or vulnerable to having a mental disorder, and then, kind of with a constellation of different environmental things and psychological stressors, these disorders can be expressed. So how does culture influence disorder? So cultural bound syndromes are disorders which only seem to exist within certain cultures, and they demonstrate that culture can play a significant role both in causing and defining a disorder. For example, bulimia nervosa, which is people who eat large amounts of food and then throw up, is largely something that's found only in North America. We do see it obviously in westernized countries, but it's not heard of necessarily in other countries. Running amok are violent outbursts, which is seen in Malaysia. We don't see this necessarily here. And hikikomori is social withdrawal, and that's something that's seen in Japan. So these are culturally bound syndromes, so they're not necessarily seen across cultures, and there's something within the culture that's causing this, or something that the culture defines as abnormal. So how do we classify psychological disorders? So the reason we use diagnosis is so that we can have a shorthand. So if somebody says, I have the flu, you know that they have, generally a fever, running nose, they're not feeling well, they might be throwing up. It also allows us to study many statistically similar cases, so that we have other people that we can look at, not large numbers of people with this disorder, and make conclusions about the etiology, the treatment, etc. And it can also guide treatment choices. So as psychologists and psychiatrists, we use what's called the Diagnostic and Statistical Manual, and this is kind of our Bible of diagnosis, which lists all the symptoms. The book in the bottom right is the DSM-4 TR, but it's actually been updated to the DSM-5 in May 2013. And we also use the DSM, the codes, there are codes associated with each diagnosis for billing and insurance purposes. And so when we see somebody, we need to give them a diagnosis, give them a code number so that they can be charged. And it's consistent with diagnoses used by doctors worldwide. So here are a list of diagnoses, and some of these we're going to be talking about in this course, and then if you go on to study abnormal psychology, you'll learn about several of the others. So in this course we're going to learn about delirium, dementia, amnesia, cognitive disorders, substance abuse related disorders. We're going to talk about sleep disorders and depression, anxiety, things like that. So what are some of the critiques of the DSM? Well, one of the critiques is that according to the DSM, too many people are disordered. In some cases, we'll see that up to 10-15% of the population can qualify as having a mental disorder, which people see as being too high. There's also a very iffy border between diagnosis and normality. So if you have 5 symptoms, you're diagnosed with a disorder. If you only have 4, you don't have the disorder, and that seems somewhat arbitrary. So there's been argument that we should have a continuum. There are also value judgments about what is a disorder. For example, is depression necessarily deviant? Is it normal to feel depressed in response to kind of negative life events? And diagnostic labels direct how we view and interpret the world, and tell us which behaviors and mental states to see as disordered. So in certain cultures, being more of a type A or anxiety-ridden person here in America actually gets you to be more productive. But too much of anxiety can be psychopathology. And then finally, we're going to talk a little bit about stigma and stereotypes. So many people think that having a diagnosis means that you're tainted, weird, or weak. And therefore, many psychologists believe we should use extreme caution in diagnosing and labeling. So I'll never call somebody a schizophrenic, because that minimizes who they are as a person. I can say this is a person with schizophrenia. But we do have to be careful when we give people diagnoses, and that these diagnoses are accurate, because they do have stigma associated with them. However, these stigma come from cultural views and not from the DSM per se. They say, does diabetes diagnosis cause a stigma? No, although I would beg to differ. I'm sure some people with diabetes do suffer stigma. Bipolar disorder, yes, it does. The DSM may contain the information to correct inaccurate perceptions of mental illness, so it's important to educate people about the biopsychosocial model, and that people often, have little to no role in the development of their own mental illness. And while they can engage in treatment, a lot of this stuff is beyond